We would like to hear, the people in the room, I'm sure, your opinion on Obamacare. Not in some long question, but what we want to know is a specific idea that you have to improve the situation, not just we want to repeal Obamacare. So we'll take it for granted that you would like to repeal Obamacare, but give us an idea of what you would replace it with, please.
Obamacare has been a failure, and it's been a failure for young people, even more so. I think the most important thing that we can do, particularly in dealing with our own party, is when we go up to DC and we say Obamacare needs to be repealed. It's broken in so many different areas that it's hard to patch it. But we have to have the courage to tell our party leadership that we're happy to do that, but only if we are replacing it with reforms that work. The most important reform is a free market system. You've got the government placing a monopoly on the insurance companies. You have got the inability of an individual to get insurance, and you are downgrading the ability and the incentive for private business that employ young people to provide that insurance. It's a systemic problem, and if you start changing that system, looking at the simple fact that how many realtors are in Florida? That's like how many students are in Florida, and yet they can't negotiate a group policy. A college can't negotiate group policy for its students. Schools can't, families can't. It's got to be an open system. That'll work.
We can't stress it enough, and no, we don't want to take this for granted, but yes, Obamacare has to be fully repealed. There is no fixing the unfixable. And if left alone, I fear that Obamacare will eventually degenerate into a single-payer solution. So Obamacare would eventually degenerate into VA for all, which is horrible. And that's actually the medical model that Alan Grayson has championed. For those of you who don't know, he's actually said the VA is the model that we aspire to. I don't know whether or not he's also alluding to waitlist fraud and some of these other things, but he has gone on the record as saying that. The solution to healthcare rests in the following. Now, we've had a democratic conversation in this country over whether or not the indigent are going to get health care or have some model of safety net provided for them. It should be for the bottom 10%. No more than that. For everybody else, the free market, the private insurance market, and uncapped HSAs. And then you let the free market flourish. You let it flourish throughout 50 states. You let people set their prices and let the market work out solutions for healthcare and surgeries. And I think you'll see what has happened with the private healthcare market, like for LASIK surgeries and cosmetic surgeries, where there's a vibrant market. And people can walk in and negotiate and set terms and set prices and well, okay, well, how much for this hip reduction? How much for this heart surgery? And work a deal out that way. We don't have that right now. But now we have $95 Tylenols and outrageous expenses because of the inflation of that added cap in the insurance market. We need to remove that, and we need to let the free market run. And that's how we'll take care of healthcare, just how we've taken care of everything else in this country.
Showing us they can do nothing right. Obamacare proves once again that we are not doing. There's 8 million supposed folks signed up in Obamacare. And in this room, there's several seniors who I will want to inform you that 2015, you're in for a sticker shock. Because those 8 million or so that are signed up right now, the 40 million seniors are going to be subsidizing Obamacare, with Medicare Advantage being obliviated. And I know because I'm working in it right now. And I'm telling you that this is what we're about to see happen in 2015. It's very important for us to understand. And real interesting that we talk about the VA, because just today, yesterday, they've been talking a lot about in Washington about now, if you live within or 40 miles away from a VA clinic or hospital, you can go see a private doctor with all the backlog that there is going on. I believe in public-private partnerships. I don't believe the government has all the answers. I believe that the people have the answers. I believe that we have stymied the growth. Right now, Florida Hospital and other hospitals in our area are buying up primary care physicians. It's getting very, very difficult to go to a primary care. I used to like going to a doctor's office. And the way things are going right now, you'll be going to a hospital, you'll be going to a major clinic, not allowing doctors who studied for so long to do the job and the practice that they want to do. But going back to the young people, this plan was built on the youth of this country. And it's going to burden the youth of this country. Those who come up and figure out that they're paying $50 a month, but they have a $15,000 deductible. And when they go to the doctor and they say, well, you know, you have to pay out of pocket before we can help you. There's a lot of things that are happening, and I think our young people are smarter than that, and that's why they haven't signed up in Groves. That's why they haven't seen the change that they've seen. Do we need reform in medical? Yes, we do. We need it all across the board. But I believe that the biggest mistake that the ACA did was try to burden our youth with the cost of Obamacare.